Welcome to Chapter 14, Assessing Quality in Health Service Delivery and Management. Important concepts that we'll cover in this chapter is to understand and use an assessment tool, understand best practices, understand root cause analysis, and understand clinical and management assessment tools. In healthcare, the word quality often refers to the care provided to patients. However, patient care is not the only area where excellent quality is a goal. High-quality management processes, procedures, and techniques ensure that programs, departments, and organizations operate effectively and efficiently. By leading well-designed and appropriately implemented management processes, healthcare managers create the basis and the environment for the delivery of high-quality care. The Institute of Medicine defines quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. Root cause analysis is the process of dissecting a positive or negative incident into its most basic elements and discovering the source of its characteristics and outcomes. One of the most common tools for performing a root cause analysis is a fishbone diagram. The tool takes its name from its appearance, which generally looks like a collection of fish bones, with a central spine and several offshoots. This is a tool used to help improve processes by identifying all the root causes creating the problem. An effective root cause analysis consists of data collection, investigation, determination, reporting of root causes, implementation of corrective actions, and monitoring for sustainability. Again, the fishbone diagram is a visualization tool for categorizing the potential causes of the problem. It's also known as a cause and effect diagram, so you may hear it described as either a fishbone or a cause and effect. Here in this figure, you see an example of a fishbone diagram. And you can see the central spine, which identifies the problem and all the contributing factors towards that problem. In any endeavor, how does one know how good is actually good enough? How many mistakes are acceptable? As it's pointed out in your text, in some industries it's very clear. For example, few people would travel on an airline that reported an average only 1% of its flights crashed. With some major airlines flying more than 4,000 flights each day, this rate would indicate that 40 plane crashes per day. And that's only for one airline. On the other hand, a student missing 1% of the answers on an exam would earn a grade of 99%, which by anyone's standard is an excellent grade. So on the caregiving side of healthcare, setting standards is a bit more difficult. The assessment is the act of measuring, appraising, or evaluating, and standards are the customary, appropriate, and acceptable criteria or outcomes. In the process of setting standards, the healthcare leadership team must consider how best to manage the risk associated with the action under consideration. The word risk means a possible, usually negative outcome, and managers must eliminate as much risk as possible. In healthcare, it is impossible to eliminate all risk, but the more certain the manager can be about all aspects of clinical or business performance, the lower the organization's risk will be for adverse events. Having best practice protocols, processes, and structures in place to ensure compliance with regulations and the law are good strategies to help decrease the likelihood of adverse events. These are important facets of risk management. These adverse events tend to fall into one of three categories: human error, equipment failure, or systems failure, either alone or in some combination. Once standards are developed, there must be a process, monitoring, in place to ensure that the organization, team, or the individual is in compliance with them. The long-established framework for evaluating quality of care is the examination of structure, process, and outcomes. Structure refers to the physical environment as well as the qualifications of the people associated with providing care. Not only does the building need to be an appropriate place to provide care, employees should be qualified and current in their competencies to provide appropriate care. The process is the activity proximately or directly related to the delivery of care to the patient, as well as the actual act of caregiving. Again, structure, the environment and set of conditions that exist relating to both physical premises and also the qualifications of the staff. And again, to recap, the process is an activity directly or proximately related to the delivery of care to the patient as well as the actual act of caregiving. An outcome is the end result, product, or conclusion to a process or event. Ensuring adequate structure and good process are necessary for quality performance, but adequate and good are only minimal standards. They are not sufficient to produce high-quality care. Best practices associated with the process of providing care must be in place. Clinicians learn best practices in their own patient care disciplines. These best practices evolve. What was proper and adequate in the past may no longer be acceptable as science advances. Processes need to be up to date, well communicated, taught, reinforced, and upheld. Comparing how an organization stacks up against a standard or a similar organization's results is known as benchmarking. It applies to both clinical and administrative processes. So in conclusion, quality has both clinical and management perspectives. Benchmarking and best practices can be applied in both settings. Root cause analysis can be used in both settings, and monitoring to continually improve can be applied in both settings.